began talking about her work in Africa and the desire to create a health facility that wasn't just providing care but creating a new generation of medical professionals.
Interesting part of it was, I mentioned we were going to be supporting the Ipuli Village project, and the receptionist at the front desk said, well, gee, it would really be great if the employees could play a role. She decided that she would start an employee fundraising campaign, and out of our 450 employees got donations from about 375 of them.
Ipuli is the village where my parents grew up in Tanzania. My father, Charles Mgana, was the only child in his class who left Ipuli to get an education. He has an international career now, but has never broken connection with his village. From the capital, Ipuli is a 2-day journey on a broken, dusty road. When women go into labor, they are carried more than 80 kilometers by ox cart and bicycle to reach the nearest hospital. The river floods during the rainy season, making it impossible to safely cross.
The idea that you would have a mortality rate compounded by, simple transportation, that was quite poignant is the way she described the need for this facility. And that made it very easy for us to say, yes, we can absolutely support what you're doing.
We always had this in our hearts in terms of going back and realizing just the opportunities that we've had and somehow giving back to the community. Finally, putting all the pieces together, we came up with this idea of the Rural Center of Excellence, which is a medical center, a training center, and a secondary school.
When we found out about the project, we came on board immediately. There's a lot of enthusiasm throughout the company. We've got a corporate vision that we will tackle tough issues facing the world, and I think this project fits perfectly into that.
There's actually a really incredible design team that's working on this, and that they've devoted their lives pretty much over the last 2 years towards this project. I think it's a testament not just to them, but also to Neema. She's more than just very convincing. She's got great determination. I think that's allowed the team to keep going.
The Ipuli Medical Training Center is going to consist of this portion as the classrooms for students. And this other portion here is going to be the initial clinic for the villagers. This portion here is going to be the laboratories for training of students. Further down is a section to be used as a library, and further on the other section will be used for the administration. The main digging this area is going to be the reservoir for capturing rainwater.
Once we have all the construction documents, those plans and designs can be downloaded by anyone in the developing world, and they can replicate that anywhere. When the focus of your project is social gain and not financial gain, then why wouldn't you open that up to allow others to replicate those facilities?
And on top of that, you can have the entire world possibly also look at these projects electronically and understand what is happening and also see if they want to get involved somehow.
Neema and the team have really strived to use local materials, local labor, but marrying that with new technologies like solar and rainwater collection. This is something very, very new. And it's almost a more honest building, that you're not just flying in some solution. You're trying to create and develop something that incorporates the vernacular of that community.
The local community has really been excited and have given their complete support for this project, including giving land, helping with building things. We have women who are weaving baskets to generate extra income. And so it's been a fabulous example of how communities and organizations can come together to develop something positive.
We're creating anchors in a community, and these anchors are not just the structure, but it's the what it means to build. And in many communities, they've had to struggle for many, many generations. And what we've done is we've been able to bring in these services in a way that kind of provides more than hope, provides solutions.
Katika maisha yangu nategemea kwamba niweze kusomea hii medical center ili iweze kunisaidia maisha yangu, kama jinsi nilivyozungumzia katika awali kwamba ninategemea kuwa medical assistant, na hii itaniweza kuninyanyua kiuchumi katika maisha yangu na pia itasaidia jamii nzima.
I grew up in this village and I've seen so many people who are sick and they don't have any place to go. So this one is going to help a lot of people, not only the Ipuli, but everyone surrounding. It's going to help so much. Everyone, they say, why don't you start very quickly so that we can use it? I tell them that it will be ready as soon as possible, but slowly but surely.